Anti-NMDA Receptor Encephalitis, a new disease discovered in 2007. Let's back it up a bit. Encephalitis is a disease caused by inflammation in the brain caused by infection that overloads the brain with antibodies and attacks the brain. It's an autoimmune disorder, which basically means that the body is attacking itself. Anti-NMDA receptor encephalitis is caused when the NMDA receptors, which are responsible for controlling electrical impulses in the brain, are attacked by the body's immune system. This causes a plethora of side effects ranging from flu-like symptoms, memory deficits, speech dysfunction, and sleep disorders, all the way up to hallucinations, seizures, loss of consciousness, movement disorders, autonomic dysfunction, blindness, deafness, and in some cases, death. The majority of deaths in patients are caused by heart attacks due to excessive strain on the body, although that's not to say that this disease is always fatal. Many patients achieve a full and complete recovery in the hospital after their treatment, while others survive but still have side effects like seizures, loss of sight or hearing, sleeping issues, or anxiety disorders. Lasso patients also survive the disease with absolutely no memory of their time in the hospital. Treatments consist of keeping the patients in the hospital for the duration of their illness under constant surveillance from doctors and nurses. Patients are also put on medications to reduce the number of antibodies in their brains. These medications are typically taken through an IV. Another form of treatment is electrophoresis, in which the patient is hooked up to a machine that filters out the antibodies in the brain. The loss of antibodies also causes side effects for the patients. Their immune systems are being weakened, and they are extremely prone to infections, so they must stay in the hospital where they can be properly monitored.
This disease is more commonly found in women because a lot of female patients with anti-NMDA receptor encephalitis have large tumors in their ovaries called teratomas. Although there is still no concrete proof that this caused the disease, there is research going on that may suggest these findings. The disease also affects people of all ages. Cases have been found in people ages 1 all the way to 80 years old. So basically, nobody is safe. There is no evidence that the disease is transmitted genetically, although there is research being conducted to find that evidence. And the disease cannot be contracted through contact with an existing patient. There is no way to prevent the disease, no vaccination, no specific lifestyle that is more susceptible, and no specific lifestyle that makes you immune. But there is no reason to lose hope. Many patients come through this disease and have minimal side effects. There is a way to cure the disease, but not everybody will be that lucky. In regards to public perceptions, patients are often thought of as mental patients. Susanna Cahalan, the author of Brain on Fire, recounted her story of the process of contracting anti-NMDA receptor encephalitis and her treatment and recovery. She was initially thought of as a crazy person until one doctor figured out just what was wrong with her: an unknown autoimmune disorder. Like, comment, share, and subscribe to learn more about these awesome artists behind the scene.